السلام عليكم. صباح الخير جميعا، واهلا بكم في المؤتمر 57 للجمعيه المصريه للاشعه. معلش على التاخير، كان في مشكله في الكهرباء بس بيسعدني ان احنا هنبتدي دلوقتي السيشن 2 scientific session. عشان الوقت برضه هيبقى كل سبيكر 5 minutes، يعني نرجو بس ان احنا نلتزم بالوقت عشان البرنامج ما يتأخرش ان شاء الله. First speaker is Dr. Ahmed Abdelwahed from MAST. He is going to talk about value of low voltage multi-detector row CT angiography. اتفضل دكتور.
Good morning. أنا أحمد عبد الواحد، مدرس الأشعة كلية طب جامعة مصر. I would like to thank the organizing committee for letting me express my work. Thank you. Our objective was to detect the effect of lowering the tube voltage from 120 to 100 kV in patients with acute chest pain concerning the image quality and radiation dose. MDCT, the method of choice for diagnosis, treatment plan, and follow-up of coronary heart disease, aortic dissection, and pulmonary embolism. Despite non-stop improvements in the CT technology regarding radiation exposure are still there. When performing 64-slice coronary CT angiography, the effective radiation dose usually average between 10 and 15 millisievert, particularly depending on the CT system, scanning technique, and the patient-related factors. Our study included 84 patients. 70 of them underwent the low kVp technique, 100 kVp, and the other 14 underwent the standard procedure using 120, 140 kVp. The procedure, after adequate preparation, we use 0.6 millimeter slide, rotation time 0.5 seconds. The current tube was 200 and 400 milliampere, using tube voltage between 80 and 100 kilovolt. The contrast media was injected at a rate of 4 to 5 milliliter per second at a volume 1 milliliter per kg. Results were documented and analyzed according to the imaging quality, whether diagnostic or not, and radiation dose compared to the control group and compared to the standard effective radiation dose. Here we can see the benefits of low kVp CT angiography, which includes lowering of the radiation burden for the patient and increased the contrast, providing the increased conspicuity of the enhancing structure. Here we can see the aorta in the low kVp technique appears more hyperdense. And then we will evaluate the image qualitatively and quantitatively. Qualitative image evaluation by two experienced radiologists in CT angiography. They were blinded to the reconstruction technique for the low kVp, and they both independently evaluated each dataset. All coronary CT and CT angiography reconstruction were recording according to a five-point scaling system, where 1 was a poor image quality with major artifacts and no diagnosis was possible, and 5 was excellent image quality, no artifact with full diagnostic confidence. And then for the quantitative image quality, we adopted the following mechanism. We put a ROI to measure the intravascular attenuation in the pulmonary trunk, right and left main pulmonary arteries, ascending and descending aorta, aortic arch, left ventricle, LAD, and RC. And the measurements were calculated to obtain the signal to noise ratio, contrast to noise ratio, objective image noise, and average vascular attenuation for each arterial segment described before. And then we measure the objective image noise regarding the mean standard deviation of the CT number of the subcutaneous fat at the measured selected arterial segments. The CT scanner usually by the end of the exam provide us with a dose linear product. Then we multiply this dose linear product by the conversion factor for the thorax, which is 0.017 millisievert. And then we get the effective radiation dose. These are the different conversion coefficient for different parts of the body used for this equation. Then we applied the results. There was highly significant difference between the two groups regarding the received radiation dose, being 4 millisievert for the first group with the low KVP technique and around 20 millisievert for the second group using the high KVP technique. And also there was significant difference as regarding the signal to noise ratio between the two groups, being higher for the group with the high KVP and lower for the group with the low KVP. And also there was no significant difference as regarding the contrast to noise ratio between the two groups. Also there was no significant difference between the two groups regarding the average attenuation and the average noise, and no significant difference regarding the 5-point scaling system between the two groups as regarding the image quality, and there was a mild increase in the average attenuation of the contrast medium in the favor of the low KVP technique. The reduction of X-ray tube voltage from 140 to 80, keeping the constant current, can theoretically reduce the radiation exposure exponentially. However, it has to be considered that a lower radiation dose is associated with higher image mottling and therefore may degrade the image quality. Moreover, higher attenuation levels for iodine-based contrast media are achieved at a lower X-ray tube voltage, owing to the greater photoelectric effect and decreased Compton scattering. The closer the tube voltage approaches the K edge of the iodine, which is 33.2 keV, the greater the inherent attenuation of the iodinated contrast medium. In this current study, the technique adopted resulted in significant lowering of the radiation dose, with a non-significant effect upon the image quality, which is in line with the studies conducted by Fanos Pogott, Reb Sweden, and Zhang et al. These are some of the images obtained. We can see the higher concentration. Finally, I have to conclude that using the lower KVP technique will significantly decrease the estimated radiation dose with no significant effect upon the image quality. Thank you.
Thank you, Doctor. So, thank you, Doctor.